Thank you all for being here. Deanna Palm with the Hillsboro Chamber of Commerce. Have some important information to relay to you today, as you all have heard about the emergency temporary rule coming from OSHA, and wanted this opportunity for a consultant to kind of walk through what the rule actually means, and for you to be able to ask any questions related to your responsibilities as employers. So it's my pleasure to introduce Russ Reasoner, who is a consultant with OSHA. Russ, thank you so much for spending your time with us here today. Appreciate it. I'm going to turn it over to you. Just let me know when you'd like me to advance the slides.
Oh, thank you very much. Good morning, everyone. As Deanna said, this is an emergency temporary rule, so it really is only to be in place for about 6 months. And as you can see, it's under Division 1, which are administrative rules. That's because it is a temporary rule. And if any of you are savvy with the code 437-001, Chapter 0744, you can look it up under infectious diseases. It is this code is specific at this time for COVID-19 workplace risk reduction, and it's like any code, it provides rules and regulations to prevent, in this case, a health hazard.
Russ, if I could just interrupt for just a second. It is a little bit difficult to hear you. If you could get a little closer to your microphone, that would be great.
All right. Can you hear me better now?
Yes.
Okay.
That's a little better. Yes. Thank you.
Oh, okay. I don't know if maybe if I increase the volume, would that help too? I don't know. Let's see.
Yeah, it sounds like it's a little bit breaking up a little bit.
No. How about now?
That sounds good right now.
Okay.
All right. Thank you.
Sure. And we haven't lost much anyway in information, so I'll just continue on. So let's see here. Okay, next slide, please. There we go. So what I want to do for you is kind of break down how the code is put together. As we said, it's the temporary Oregon administrative rule, and it does have appendices. And these appendices in it are basically all of the Oregon Health Authority guidance or guidelines you've been working with since the beginning of the COVID-19. And as you can see, there's 105 pages associated with it. Now, that seems like a lot, but if you actually look at the text that contains most of the information of the rules related to COVID-19, it's only about 21 pages. Like I said, it's a 6-month temporary rule. It was effective November 16th and until May 4th of 2021. Now there are some other specified timelines we'll talk about a little later. Hopefully only this can take about 5 minutes, and then we'll get into some Q&A. It's broken down in the 21 pages from page 6 to 15 on all workplaces. And then exceptional risk workplaces, which are specifically defined, you can find on page 16 through 21. Now the code's broken down into sections. Section 1, scope and application, and it's basically saying this applies to all workplaces in Oregon. And then section 2 are the definitions. And these are important to read and understand because they relate to the rules 3 and 4, or section 3 and 4 below. So section 3 is all workplaces, and then section 4 are exceptional risk workplaces. Next slide, please. So can everybody see this? This is a timeline and directory, and at the very top, I don't know if I can. Oh yes, can you see my cursor? Maybe not. But at the very top, it says requirements in the following subsections of this rule. So sections are broken out, in this case, into 3. Section 3 is all the white, and then section 4 is all the gray. So it's broken out like that. Oh, you can see the cursor, okay. So then the subsections are 3A, 3B, 3C, et cetera, and goes on. And then each on the row for all workplaces, that would be that section 3 I talked about. You have your subsections 3A through 3M. And you can see that all these different subsections apply to all workplaces. And there's a couple missing here under written risk assessment and under written infection control plan. Now, that's indicating that if you have 10 or less employees, you do not have to have a written risk assessment or a written infection control plan. You do need to do a risk assessment and you do need to have an infection control plan, but they do not need to be written, again, if it's 10 or less. Now, if you have 10 or more employees, or if you have more than 10 employees, then all the subsections of 3 apply. And then if you go into exceptional risk workplaces, all of subsection 3 applies, and all of subsection 4 applies. And you can see that now the reason for that next slide, please. Oh, no, wait a second. And then the other part of it are the effective dates. So if we look for the first note, it says building operations are not effective until November 23rd, 2020. And then the second note, risk assessment is not required until December 7th. And then the next note, let's see, 1 star, employee information training, that has to be completed by December 21st. And then the 2 stars, which is ventilation requirements, effective January 6th of 2021. Okay, next slide, please. So if you want to know about exceptional workplaces, it's basically includes any setting, whether healthcare setting or not, where an employee, including temporary and part-time employees, perform certain duties or combination of the following job duties. And that would be, as listed here, direct patient care, environmental decontamination services, aerosol generating healthcare or postmortem procedures, direct client service in residential care or assisted living facilities, emergency first responder activities, personal care activities involved very close with an individual, such as toileting or bathing, or handling, packaging, cleaning, processing, or transporting human remains or human tissue samples and or laboratory cultures collected from an individual known or suspected to be infected with COVID-19. For the most part, that is going to be related to the healthcare industry and not so much to all other workplaces. Also, too, direct patient care has a specific definition, as we talked earlier about the importance of looking at the definitions. So does environmental decontamination services. There's a specific definition for that. Same for aerosol generating healthcare. So there are these different definitions that you really need to look at. Same for emergency first responder activities. So for example, if in your work, you have someone or several people that basically under Good Samaritan law would respond to a first aid emergency, they are not covered. This is basically for the first emergency first responders that show up like in ambulances, EMTs, EMS, that kind of thing. All right. Next slide, please. And then, so to get to the resources on Oregon OSHA website, we have an A to Z topic list, and under infectious disease, you will find the temporary rule 744. You can also call technical or reach technical, and consultative services were available too. There's no fee for safety, health, and ergonomic consultations. We provide our information is kept confidential. We provide specific comprehensive training and speaking engagements. And right now we are doing because of the freeze, we are doing the virtual consultation such as this right now. And you can reach us through our Portland area phone number and request a consultation, or if you have a question to ask, call us anytime. And then, of course, there's federal OSHA. Now, all of these, and Deanna, you can share this with anybody that wish to have this presentation. And these outlined in red or underlined in red, these are basically links. So you just click onto the link and it'll take you directly there. That's all I have for now. Maybe that was a little over 5 minutes. I apologize, but open it up now for Q&A.
Great, thank you so much. I'm assuming we're going to have a lot of questions. So what I would ask folks to do, I think I'm going to stop sharing this so I can actually see the screen and can see when folks raise their hand or the hand on the Zoom. But I'm going to open it up for questions. If you have a question, there's there's a lot of information on the websites, but this is an opportunity for you to get clarification or ask specifically about your business situation. So anybody have a question?
I have a question.
All right, Linda, thank you.
This is Linda. I'm a pianist and I go into retirement homes and play the piano. How does this rule affect that?
You repeat the question again?
I'm a pianist and I go into retirement homes to play the piano to create, that emotional connection. How does this rule affect that?
Well, this really is only related to employer-employee relationships.
Okay.
If you go in and you just provide service for a piano, you'd probably be more under the Oregon Health Authority guidelines than Oregon OSHA.
Okay.
I mean, you're not being paid to do this, it sounds like.
Oh, I'm paid to do it.
Oh, you're paid to do it, but a sole proprietor.
Yes.
There is part of a definition in there where it talks about that any individual associated with an employer can be affected, COVID-19. So that might be a situation where you may want to do a risk assessment, that's associated with your work in terms of who you might come in contact with, but you don't have employees, correct?
No.
Yeah. So it wouldn't be related to the employees. It would just be related to you. Are you covered under workers' comp insurance carrier?
I have liability insurance.
You have liability, but not under
Not
workers.
working. No.
Yeah. So the code really doesn't apply to you as it would to someone else that would have employees.
Okay. Thank you.
Yeah. You're welcome.
I think that Melissa has her hand up. Melissa?
So I have a cleaning business, and one of the rules that I heard is that you can't use more than 50% of a vehicle's capacity. So if we have a 5-person vehicle, how many people are we allowed to have? 2 people in that vehicle or 3 people?
Now
And then
yeah, that's a really good question. This is where I can share the screen, right?
Yep, you should be able to.
Okay, so let's go here. And let's see how I can move
There we
up
go.
on the screen. Oh yeah, here we go. Okay, so when we talk about there's a part in here about travel. Let's see. find it. I wish there was a faster way to scroll. Oh, here we go. How can we do that? I think it's what they're stating in the rule now is that you can wear face masks. I'm not seeing the 50% requirement anymore. It's if you wear a face mask, you know, you can do things like roll the windows down too, but wearing face mask while you are in the vehicle. And I'm not sure that.
So my other question on that would be so my employees typically eat in the vehicle, and especially now that there's nowhere for them to go inside to eat, how do they take their lunch break? If it's pouring down rain or if there's snow outside, what do I tell them to do as far as, because they're gonna have to take their mask off to eat. But there's not really,
they eat in their vehicle, correct?
yes, but together.
Well, do they come to work together?
They drive to our office individually, but then they leave from our office together.
Oh, so it's like a delivery?
No, we're a cleaning service. So we typically go out in teams of 2 to 3 people.
Okay, so you can use what's called a cohort, is where the same people, the same team members stay together. And so that way, if someone gets COVID and the other one gets COVID, you're not spreading it to different employees. It's just that team. So that would be a risk assessment that you'd want to do, but using a cohort, a team basically approach. That they stay together, and because they go out and they're a team and they stay together like that, and they eat together during lunch. I mean that's where they would eat, would be in the vehicles, correct?
Yes.
Yeah. I don't see a problem with the lunch issue, given that they're cohorting.
Okay.
And then would they just wear the mask when they're not actually eating while they're in the vehicle driving and stuff? Is that
right? It's kind of crazy because if you can in some way, are the vehicles banned or are they just regular cars?
Or they're Jeeps. They're Jeep compasses.
Okay, because it does require 6-foot distancing when the masks are off. So is there some way that you could set that up so there would be locations where they could eat where they'd be 6 feet from each other?
Only if we tried to put one person in the trunk.
On the what?
Only if we tried to have one person sit in the trunk, the back area. But with 3 people at work, there wouldn't be 6 feet between each of them.
Yeah, so here's another possibility. I mean, these are kind of the ways you have to think outside the box. Can they carry, or can you provide them maybe with overhead shelter they can set up and then eat outside?
Okay. Yeah, I can look into that.
Yeah, that way that they can eat quickly, and if they need to warm up, they can get back in the van or whatever. But that would be one way to keep them 6 feet apart. Is there just 2 to a team, or is it 3?
2 to 3, depending on the day and the schedule.
Yeah. But that might be one way of doing it, setting up some outside cover for them. So they can
Okay.
go outside. Yeah, the 6 foot rule is what's important, because once you get within 6 feet, you take the mask off, that really increases the risk.
Yeah.
Okay, we have a question from Tim. I will ask you to unmute Tim Maxwell.
Hi, Tim.
Yeah. Can you hear me?
Yes.
We can.
Hi, Russ. One question in 3 parts. The exposure risk assessment and the infection control assessment, those both have template forms to complete, correct?
So the risk assessment, which I have up here right now, go down here, right? Jesus. Let's see. Here we go. Right here is a risk assessment template under blue underline highlighted. That's actually a hyperlink. Now the other one you were saying, infection control plan. If you
Yes.
go down to that, gone too far again.
I think I saw it, Russ.
Yeah, I'm trying to. There. No, that's infection notification process.
Page 12, Russ.
Page 12. Okay.
The link you're looking for? Right there.
Okay, there we go. This, right, so that link, that's, it's a sample, it's not a template, not like the risk assessment form. So when you go to click on this, it will give you an example or a sample to assist you in completing the infection control plan. And then there's one more, I don't know if you knew this too, but notification. Wow, this is just really very touchy. Yeah, training notification, but there is a, right here, model procedure for notification. So notification process established.
Okay.
There are those available to you for use, yes.
And then with the employee training, is there a template for that, or are we again modeling something?
So part of the training is a notification, but right up here, it says Oregon OSHA will provide training materials that can be used to complete this portion of the training. So at this point, the training materials are not yet available, but they will be provided. And if you go into our website, and when you get to the website, you go to A to Z topic index and click on I for infectious disease. It will take you to the website that actually has or will have the training materials.
So it is a particular set of rules that need to be fulfilled to satisfy that requirement?
Yeah, right here. So, oops, I can. Yeah, right here, employee information and training under I. No later than December 21st. We talked a little bit about that earlier. And then the requirements. So training on physical distance requirements is applied in employer's workplace. A through J are the requirements for the training.
Okay.
Yeah.
All right. Jim, it looks like you have a question. I'll ask you to unmute.
Hi there. I am the technical director over at Bag and Baggage, and we are, of course, shut down because we are a theater company. We only have 6 full-time employees, and we are all currently working remote. However, like everybody else, we are looking to figure out how to continue to do our work and get it out to the public. And in this case, myself and the company manager have already worked on risk assessment, COVID sanitation and activation plans, notification, and we've put safeguards into the access to the building. But our numbers will vary once we actually start trying to do things. So we have, like I said, 6 full-time employees, but we are getting ready to, we're looking into filming a production of Christmas Carol, which will involve 3 more people. They will be only contracted for that. Do we need to go ahead and do a written risk assessment? I mean, we're already working on one, but do we need to go ahead and do that written risk assessment? And the other thing is our facility could possibly be used for meetings. I know people have already approached us about that, and we have already decided that the building will only hold 20 people safely as far as traffic flow and distancing and use of restrooms and facilities, that sort of thing. With that in mind, those aren't employees, but does that also then require us to have a written risk assessment for up to 20 people in the building?
Yes. So you'd want to do a separate risk assessment related to the contract you have with the singers. I guess that's what you were saying, correct? You say it's theater, is that correct?
That is correct, yes.
Okay. Yeah, so with those individuals, you'd want to do an assessment so that
Okay.
you understand, how to distance those individuals. And since they're singing, they're going to have their masks off. Is that correct? Or
Yeah.
with their
They
masks on.
Yeah. Mm-hmm.
I would recommend, if possible, that you could set that up with microphones. I mean, is it possible they could sing with the mask on?
Oh yeah, no. We're going to for example, the Christmas Carol that we're doing, it's a one-man show with 2 musicians. So
Understand.
that actor will have a lavalier body mic on,
Okay.
and will be the only person ever unmasked in the room.
Okay. And is it possible to keep them perhaps like 20 feet away from the rest of the audience?
There will be no audience. There'll be 2 camera operators and 2 musicians, and the space is 32 feet wide and 24 feet deep. So we should be able to keep them away.
You're okay.
Yeah.
All right. And about your foot traffic, you were saying that you're going to extend the number to 20.
We have had requests for meetings in the space of up to of not yet up to 20, but I have done a physical layout. I have drafted the entire space and built basically 6-foot safe zones in the space, and we can comfortably get people seated, about 20 people into the space, leaving 6 feet between everybody in the room.
Yeah, and now the governor's requirements too is to stay masked unless you actually move into an area that's basically an office with a closed door.
Yeah, all of our contract agreements with anybody coming into the building would include, we have a TARI temperature check system, monitoring system that they have to walk up to, and it scans them, and we get a readout of everybody that comes in the building, and it requires masks at all times.
Very good. Yeah,
right.
That again, you have less than 10 employees, correct?
Yeah, we have 6 full-time employees. All of us, with the exception of myself, are telecommuting, and I am only in the building 2 days a week. And that's mainly to monitor. I'm in charge of the physical plant as well, so that's to monitor systems and that kind of thing.
Yeah. So I would say that you don't have to have a written risk assessment. You don't need a written infection control plan. But having planned out what you've done, is in a way a risk assessment and is the process by which using hazard controls to prevent the spread. So it sounds very good. Well thought out.
All right. We have, in this order, we have Hannah, Anthony, and Patricia. So I'll ask Hannah to go ahead and ask your question.
Diana?
Hi, so I work for Care Partners Hospice. So we provide hospice in the community where in people's homes and skilled nursing facilities and adult foster homes and whatnot. So we're definitely falling under the exceptional risk workplace.
Yes.
So I guess my question is, I mean, we have clinical staff and then we also have admin staff. And so we still have people coming into the office. And then some of the clinical staff are also working in the office. Sometimes all of the clinical staff are coming in like twice a week to get COVID tested. So I guess my question is, do you think that we need to have one risk assessment and infection control plan, or should we have two, like one for just the people in the office and then one for our clinical staff?
Yeah, so again, part of that, what you would call the risk assessment, or the definition for your type of risk assessment. One would be for exceptional risk workplaces.
Okay.
And the other one would be related to just the staff that aren't involved in those kind of job duties that put them under exceptional risk workplaces.
Okay. Okay, I think that makes sense.
Is that it?
Yeah.
Okay.
Thank you.
Yep, you're welcome.
All right, Anthony, you're next.
Hi, thank you.
Hi, Anthony.
I work in the construction industry, and I wanted to know more information about the ventilation requirements effective January 6th. You know, let's say if we're working on a home that's under construction, obviously if we're working on framing, there's lots of ventilation because we're working outside. But if a home's framing and siding is complete, does opening windows suffice for ventilation, or do you need a more elaborate system in place?
What you're approaching or asking is probably dependent upon how open it is. But once you start closing up and putting windows frames in it and things like that, and you have walls, it really restricts the airflow. And they're asking basically to wear a mask at that point once you're inside the facility, so that there's no guarantee in terms of how the airflow is going to behave in that situation, because it's not a commercial HVAC system or a residential HVAC system designed for the interior. So they do suggest to use, and I'm going to try to get to that here, maybe if I can get it a little faster. There's a specific appendix, here we go, under construction operations. There we go. And that one was easier to get to. That, whoa. So it says ensure workers maintain 6 feet. That's given. Limit work in occupied areas of a home or other structure to only those tasks, and when it's not practical, maintain physical distance 6 feet. Ensure workers remain separate to the largest degree practical, and that the duration of such activities is kept as short as possible. And then when it goes to the masks, so then we go to right here. Such employers must require all employees, patron, other visitors 5 years unless they are eating, drinking, covering, or face shields in all indoor spaces and in all outdoor spaces whenever at least 6 feet of physical distance cannot be consistently ensured. So if you can work inside, and if you do have some ventilation set up so that you got a cross breeze going, that's really good. That's better than nothing. But the problem sometimes with working inside is people have a tendency to walk back and forth to each other within that 6 feet, and so they're going to want to make sure that they have basically their basically their mask on at that time, or face coverings on. Does that make sense?
Okay, yeah, so what I took from that is kind of do what you can, open windows, set up box fans, and of course require masks and distancing.
Right.
But what about let's say like office spaces instead of, because we have an office space in addition to our construction sites. So kind of same story, set up box fans, wear a mask, keep the air moving.
If you can open the windows, that's great. Or if you have some of the call them job shacks or job sheds or offices, some of those actually have, unless you have like an actual building with offices in it, then it would be based on the HVAC system that's already designed in the building. There's some things you can do to improve upon that. You can call an HVAC person and see if they can increase the amount of fresh air that's coming into the building, to reduce the amount of recirculation of used air. You can do that. You can also increase the filter efficiency. So typically, commercial buildings run on a filter with a MERV. It's a minimum efficiency rating value of about 8. And you can, for most commercial operations, that's why you want to check with your HVAC service company. But for most HVAC commercial operations, you can actually upgrade to about a MERV 13. So that's another way of improving filtration and at the same time bringing in more outside air when you actually have an HVAC commercial system. If you're in a job shack or something like that, you can open the windows. That might be another possibility. Or if it's really cold or there's a lot of smoke or whatever, you can also get these portable HEPA filtered, high efficiency particulate air filter fan combination. You might have seen them. They have them in Lowe's or Home Depot, and they're basically rated for allergy and pollen reduction in a home, and they are rated to look at the square footage in order for them to be effective. So you have to look at the square footage that would be used, but it has a rating for that, and you can put those in offices as well, especially with doors that close and things like that. Those are effective as well to help reduce the potential for the spray.
Okay, thank you. I appreciate that.
Yeah, you're welcome.
Russ, I just have a question about that. When you talked about a specific type of air filter, and it just seems like some of those things now that we're into this deeper freeze, and where OSHA is coming out with regulations and requirements that there's not going to be adequate supply. What should employers be thinking about in terms of if there are some mandates that due to a supply shortage that they can't accommodate?
Sure, that the COVID-19 risk reduction workplace rule was based upon stacking or layering protection. And there is going to be times when, well, there's a good example when we had all that smoke from the fires. That's a really good example where you really don't want 100% air coming into the building, because at that point, that's going to be a hazard as well, maybe more hazardous. And so there are limitations, and we're only asking what can be feasible. We're not asking that you put in new HVAC systems. We're not asking that you change anything drastically or make it more unsafe than what it already is. We're just asking to make some modifications that are feasible at the time. And of course, as seasons change, that's going to have an impact. Now, one of the things that there's a cost to doing this is in the wintertime, when the HVAC systems are running, And if you have 100% air coming in, then that means in order to maintain 72 degrees, that heater is going to be on all the time. So that cost is going to increase. So that's something to take into consideration. But it's hard to say. That the best thing is to talk to your HVAC company or service company and see what they can do for you in terms of maybe reaching an area which you can afford and at the same time make it more protective. And then again, there's always the 6-foot rule and always the use of masks. There's always the cleaning requirements, you know, the high frequency touched areas. There's also the training that's required, the risk assessment, the infection control plans. All these things are layers of protection, because not just one, what we call it, one part of the code is going to be protected. You have to layer these, and of course, the more layers you have, the more the risk is reduced. The less layers of these that you can provide, it increases the risk.
Great, thank you. Patricia, did you have a question? I think it might have been in the chat. See if I can find it. I think that there's also questions in the chat regarding timing of when training materials will be available through OSHA, those kinds of things.
Sure. So that's hard to say at this point. I can give you some. So I'm going to stop sharing here. And if you want to go back to the presentation again, we can go back to that table. I'll give you some indication. Can you hear me?
Yep.
Okay. Great. So go to the table. It would be number 3. There.
Whoops. It's gonna refresh here.
Okay. No problem.
Maybe.
Something's happening.
Something is happening very slowly. All right.
Yeah, right there. So given that we have these effective dates down at the bottom, and that if you look for training, I think it was December 7th. Let's see here. Employee information and training. No, December 21st. So at that point, I would expect they're going to have some training material available before then. Just so that when it becomes effective, it will be available. But I can't say, I've not been informed as like on this date that training information or material is going to be available. So I don't have a really good answer for that.
Okay. But is there a place where folks can sign up to be notified when OSHA releases training materials or templates or the things like that?
Not that I know of. There is, so you can always go back and check from time to time under infectious disease, under our A to Z table, and see from there if they posted something. Sometimes there is a news broadcast, but I have no control of that or know when they're going to be doing that myself. I'm surprised when I hear it on the news. So we're not really notified about that.
Got it. Thank you.
Yeah.
I know Patricia actually had her question in the chat. It says, can you please explain some of the requirements on the chart that are not self-explanatory, such as ventilation requirements? I rent my office space and have no control over HVAC.
Right. So you can ask your building owner. So there's this one over here, 3E, building operations. And that actually has to do with the building owner or management. And they're going to have some responsibility. Now, most of their responsibility is just to make sure that certain parts of the building that are common touch areas are cleaned. That's one of them. But another part of it would be if they operate or manage the HVAC system. And then that's where you as the tenant would have the right to go forward to your landlord or to the owner and say, look, we want to make sure that we have good air ventilation in our office, especially if a lot of people have to be at the office. The best thing, if possible, is try to design things so a lot of people can actually telecommute so they don't have to be in the office. But if that's not possible, then changing or modifying the ventilation system to reduce the risk of the COVID spread is a really good idea. And it may take that you cooperate with the building management or owner.
All right. We also have a question from Susan Baker.
Okay.
Susan?
Hi, Susan.
Hi, I work in the restaurant industry with a variety of different kinds of restaurant operations. And we are having great difficulty meeting all the guidelines that you say with the 6 foot social distancing. We have small kitchens. We have employees wearing masks. We are trying to make sure that people are facing different directions when we can, but when it's busy times, everybody's working right next to each other in the kitchen. They're passing plates, they're, filling up everything. And there is just no way to operate and get food out hot, quickly, etc. Even for takeout. Even though we're closed down for dine-in, still the same situation on takeout. Are we going to get in trouble because of that? And we have done everything we can prep-wise. Times when we're slower, we make sure everybody's 6 foot apart. But when you're in your high demand time, it just doesn't work.
Yeah, so I have seen some complaint responses where you have basically a customer or someone in the public go into a restaurant, and when they complain, they basically complain when they say, well, we were served, but the waitress or waiter did not have their mask on. Or they're not cleaning frequently enough. So that the issue isn't so much wearing the mask as when not wearing the mask. So by wearing the mask while you're still cooking or prepping, bussing tables, providing service, the waiters and the waitresses providing their service, taking orders. If they're wearing their mask, we don't see the complaints. It's when they're not wearing their mask that the complaints come.
Well, I have to say, from an employer standpoint, we have restaurants, you required it back in March, masks all the time. We've been wearing masks, we're not open. Even when we are more than 6 foot apart, we've been wearing them since March because that was a requirement in the restaurant industry. Nose covered, face covered, worn properly, provided masks for all the employees. Our issue is getting the consumer to wear the mask.
I totally agree. And there's only
for the safety of our employees.
Right. There's only so much that you can do. Now, I recently came across one where the issue related to employees confronting basically people coming into the store without wearing their mask. And it led to violence. And that's something, Oregon OSHA does not condone violence. So we understand that concern. What we're asking is that if upon entry and someone refuses, see if you have some other alternative form, such as curbside carry out, something like that, or take their order outside and see if they're willing to do that. If they become hostile, you may want to check on this with your lawyer, but in the state of Oregon, trespassing merchant can basically state that if someone is not wanted in their facility and that person does not want to leave, then that's considered trespassing, and then they have a right to call the authorities to basically come and remove the person from their premises.
The issue is for operators right now is in many municipalities, small counties, etc., the police will not come on those calls.
That's that I expected.
And for us, we are trying to circumvent it by it's at the door. You won't wear a mask, we just don't let you in. We're happy to have you call from the car. We will be happy to bring your
Great
order out.
alternative, yes.
But we are trying, and we are trying to circumvent it also by explaining to the guests, not the health reasons, even though it's science, it's not a hoax, sorry, but you can't get into that argument. It's an economic necessity for us. Oregon OSHA will fine us $10,000. We must keep our employees safe and we will be shut down. We cannot allow you in the building.
I will say this, if you have actually gone through the alternatives, asking them, stay at the door, we will provide you the service at the door on the outside, or if you want to go to your car when it's ready, we'll call you, or you can come and pick it up at the door. That's great. And if then they still refuse and they want to come into your facility and you call the police and they do not respond, you have done everything that's reasonable of an employer to provide protection. And don't fight them. At that point, because they could become hostile, you don't know how people are going to react.
We're not going to have 16, 17-year-old young ladies and young gentlemen that are working as hostesses. That's the difficult part. It's like, we have young kids that are trying to follow rules and we tell them, no, you can't fight with them. Come get us.
Right.
We'll talk to them. But it is horrifying how disrespectful the consumer is right now to businesses. When we are trying to stay open, we would love to be open again to the public in the hospitality industry. We are just going under. And we are trying so hard to follow every darn rule.
Yeah, but I would, as much as possible. So we do have violence in the workplace guidance, and again, if you go to our A to Z subject list, you can.
We've already looked at that. Yes.
Okay, and so the idea is, just to promote to your employees. Look, if they become really belligerent, they want to come in, let them come in. Let's get them served. Let's get them out. I'm not saying that that's what Oregon OSHA wants, but if the police does not respond, you've done everything you possibly can, and you do not want to.
Okay, can I give a second side note on that though? We have had in one of the groups of restaurants I work with in a group of small communities, they have done that, and then they have had Oregon OSHA called that we allowed somebody in because it's this 16, 17-year-old kid, because I can't fight him. I'm going to have to let him in. There's nobody to be able to get the person, to talk to him, to try to be reasonable.
Right.
And we've had restaurants get citations and letters that we're going to be fined, even though we have done everything we can. And that's a big concern for our industry.
And that's all an employer can do. I mean,
but we're still being told we're going to get fined if it happens again and we get, a complaint again.
Well, I would then go to technical. Remember that in that slide, that last slide, I had a underlined or hypertext technical. I would go to them and talk to them about that. Either Renee Stapleton. I would talk to Renee Stapleton.
All right, because it hasn't been the restaurants I work with, but other restaurant groups that I know, and a couple service stations I know that have actually been fined, and they've been trying to follow every rule. But if the consumer doesn't want to follow the rules and we can't get police backup or anything, we're trying to protect our employees.
Right.
And fellow guests.
So we're just winding out of time. So I did want to, make,
sorry,
that's all right. Make mention of one other, just if you're not aware, if you're an employer and you are requiring testing, that is a cost that the employer must bear.
Yeah,
So just make sure that you know that. I know that that question came up this morning on a different phone or a different call I was on, and there was an employer that was requiring testing for their employees, but also requiring them to pay for it, and that doesn't follow OSHA rules. Am I correct, Russ?
Yeah. That's correct. The employer has to pay for any testing that they request. However, if OHA requires the testing, then the employer does not have to pay for it.
Right. And then also, if if paid time off, or paid time off because you've been in contact with someone with COVID, just again, the federal rules that are on top of your paid time off as well, making sure. I think that's where things start to get really sticky with employees is, when something happens and they're required to either quarantine or take time off, and that who's going to pay for what and how am I going to be compensated. That's where at least I've seen real issues come up, is making sure that there's a real clear understanding of who's being, how you're being compensated, or how you're being charged for some requirement.
I have a link that I will send to you, Deanna, that you can pass out to everyone. It relates to the type of federal programs that are available for relief.
That-
And I will provide that to you. It's written by a lawyer.
Oh, that's excellent. Thank you so
Yeah.
much. And what we'll do is we'll send this PowerPoint and that supplemental information out to all of the attendees. So anybody that has, that signed up will get this information. Any final questions? We're kind of out of time. Don't want to take any more of Russ's time, but I know that if you have additional questions, I'm sure he'd be happy to respond in email and direct us. And I'm assuming that we'll probably have other conversations with OSHA as we roll out some of these other requirements and training pieces and materials. So Russ, thank you so much for your time today. Truly appreciate it.
I appreciate being able to help out. Thank you.